Are vaccines safe during pregnancy? And what are some vaccines that are recommended during pregnancy? In general, vaccines that contain killed viruses or inactivated viruses can be taken safely during pregnancy. Research shows that taking these vaccines will not make you more sick, won't cause any harm to your fetus, will not result in any pregnancy issues or birth defects, and do not cause autism in children. Vaccines that are safe and commonly recommended during pregnancy to prevent serious illness are the flu shot or the influenza vaccine. This vaccine can safely be taken at any time during your pregnancy, and it protects you from getting severe flu. In addition, this vaccine produces antibodies that are passed on to the fetus, and these antibodies protect your baby during the first 6 months of their lives before they can take the flu shot themselves. Number 2, the Tdap vaccine. This vaccine protects you from tetanus, diphtheria, and pertussis or whooping cough. It's recommended that you take the Tdap vaccine between 27 to 36 weeks of each of your pregnancies. Babies under 3 months of age are at a high risk for developing severe disease and death from whooping cough. Newborns cannot get the whooping cough vaccine until about 2 months of age. Getting the Tdap vaccine during pregnancy generates antibodies which are passed on to your baby and can protect your newborn from whooping cough. Number 3, the COVID vaccine. This vaccine can be safely taken during any trimester of your pregnancy and protects you from getting severely ill from COVID-19. If you have received one shot of the COVID vaccine before you were pregnant and it's a 2-part series, it's recommended that you go ahead and take the second shot during your pregnancy. Similarly, if you have received the COVID vaccine previously and you are eligible for a booster, you should go ahead and take a booster during your pregnancy. The COVID vaccine also produces antibodies that are passed on to your baby, protect your baby from getting severe COVID during the first 6 months of their life before they're able to get the COVID shot themselves. Number 4, the respiratory syncytial virus or RSV vaccine. This is a virus that is highly contagious and dangerous, especially in babies. It is recommended that pregnant women get the RSV vaccine if you are between 32 to 36 weeks of your pregnancy at the time of year when the spread of RSV is the highest. This is usually fall and winter or from September through January. The antibodies produced by the RSV vaccine are passed on to your baby and can protect your baby before they can get the vaccine themselves. It's important that you take these vaccines because during pregnancy, your immunity is lower than usual, and if you do get infected with the flu or COVID-19, you are more likely to develop severe illness. The flu, RSV, and whooping cough are also more dangerous in infants. Getting vaccinated with the recommended vaccines during your pregnancy can not only protect you, but also your baby from severe illness.